Thank you, Chandler. Well, the nation's top health officials are warning about a possible second wave of the coronavirus. Meanwhile, the rush is now on to find new therapies to treat and potentially cure the virus. Eyewitness News reporter Jan Carabeo is live in Center City with what's working and what's not. Good morning, Jan.
Jim, good morning. It appears that one of the more successful treatments for COVID-19 is actually being performed right here in the Delaware Valley. We're going to take a look at that in just a minute. But first, health experts are sounding the alarm. They are issuing a strict warning today about a possible resurgence of COVID-19. This winter, the coronavirus could come back with a vengeance. That's the warning from CDC head Robert Redfield, who told the Washington Post on Tuesday fighting the virus could become more difficult in the winter when it dovetails with the beginning of flu season. The World Health Organization echoed that sentiment this week, suggesting politics are also getting in the way.
Trust us, the worst is yet ahead of us. Let's prevent this tragedy. It's a virus that many people still don't understand.
Scientists worldwide hope by the fall there will be a reliable therapy. There had been early hope that the drug hydroxychloroquine would be that medicine. President Trump even touted its effects.
I think it could be a game changer.
But a new study of U.S. veterans infected with COVID-19 found people given hydroxychloroquine died at a higher rate. About 28% who were given the drug plus usual care died, versus 11% of those just getting routine care. But the study was not a rigorous experiment and has yet to be reviewed by other scientists. One of the more promising interventions is using blood plasma from recovered patients and giving it to those who are critically ill. That is showing signs of success across the country. In South Jersey, doctors at Virtual Voorhees Hospital successfully treated their first two patients with the procedure.
We managed to take the plasma from the recovered family member, transfuse it into my patient, and then my patient's condition began to improve within 24 to 48 hours. You saw dramatic improvements in his oxygenation as well as his chest x-ray. So it was quite a miraculous feat.
Doctors and researchers are now urging those who've survived coronavirus to consider signing up to donate plasma to help fight the pandemic. And we are now learning more about the possible origins of the coronavirus here in the United States. It was originally believed that the very first death came out of the Seattle area on February 29th. We have now learned that two other people died before that. California officials announcing that those deaths happened in early and mid-February. In Center City, Philadelphia, Jan Carabeo, CBS 3 Eyewitness News. Janelle, back into you.
All right, Jan, thank you.